is said about their contributions and their commitments. This week's heroine is an 82-year-old woman from Orlando, Florida, who just can't give enough. As Time for Living's Carolyn Murdoch tells us, there's just no end to the kindness of Vantrese Russell. What a wonderful, caring person. And just a few months ago, Vantrese Russell was awarded the National Caring Award, which is given to a select few by the Caring Institute in Washington, D.C. We concur that Vantrese Russell was a perfect choice. If you want to suggest somebody for our Second Effort Salute Profile segment, then please write to us at Time for Living, care of Second Effort Salute, P.O. Box 8452, Boston, Massachusetts, 02114. You can leave all right. Love to hear from you. When Time for Living continues, we'll be traveling around to a land with a history of political turmoil and a future of unlimited beauty. And if you stay with us, and if okay. Coming up, urinary incontinence, the myths and the realities. A woman taking the time to care for those who need it most. And we're traveling around to the mineral-rich lands of South Africa. All this and more is coming your way next on Time for Living. And welcome to Time for Living. I'm Janet Jagalian. Howard Nielsen is on assignment. Now, if you're joining us for the first time, Time for Living is a source of information for and about people over 50. But if you're not there yet, don't worry. The information you see will help you help and understand your family and friends who are over 50. Each week is filled with news stories, features, profiles, financial and medical tips, and travel segments. So welcome to both our old and new viewers. In today's lead story, we're discussing a physical problem that nobody really likes to talk about. However, it affects more than 13 million adults, mostly older women. We're talking about urinary incontinence, more commonly known as bladder control. And perhaps the most troubling aspect of bladder control is that people don't seek help for something that can be corrected. From Philadelphia, Pennsylvania, John Nestor provides us with this preview.
Carmela Huell does special exercises once, sometimes twice a day to control urinary incontinence.
I will do them because I know it's part of my life. And you just take time to do it. It's only 10, 15 minutes.
But unfortunately, many people don't seek help for the problem. Often they're afraid.
They will hide the problem from family members, especially from children, because they feel that possibly that may mean that they move on to a nursing home.
The U.S. Public Health Service is issuing an updated set of practice guidelines that address prevention and treatment of urinary incontinence. There's information for both patients and healthcare practitioners.
What we really need to do is we need to educate the consumer to come forward and to demand treatment, but we also need to educate doctors, nurses, physical therapists to ask about the problem.
And for the first time, the new guidelines address treatment of incontinence within nursing homes and other long-term care settings.
This guideline has an entire chapter on this problem, giving suggestions of what to do in nursing homes, in home care, to assist caregivers.
Mostly, authors of the guidelines say the intent is for more people like Carmela Huell to seek help and stop suffering in silence. I'm John Nestor reporting.
When we come back, we'll talk with an expert about urinary incontinence and sort out the myths from the reality. So stay with us. Time for Living. We'll be right back.
Oh,
Yeah, hello.
are we alone?
Count to 10.
Oops.
Count to 10 for me.
1, 2, 3, 4, 5.
Are you
There.
stuck there?
Yeah, I was tangled. 6,
Okay.
7, 8.
Welcome back to Time for Living. Joining me now to discuss the myths and realities surrounding urinary incontinence or bladder control is Dr. Neil Resnick, Chief of Gerontology at Brigham and Women's Hospital in Boston, Massachusetts, and Associate Professor of Medicine at Harvard Medical School. Welcome to Time for Living, Dr. Resnick.
Thank you.
You know, this is a topic that I'm sure is not discussed frequently at cocktail parties or even at coffee clutches where a lot of women are involved. It's a very private thing, but it's an issue that is so important in the lives of people that I'm just so surprised it isn't discussed more. Why do you think that is?
Well, you're right. It's one of those things that is in the closet, in the water closet, if you will. At least 30% of older women suffer from it. Roughly 20% of older people in general do, but it's a problem across the ages. And yet, too many people chalk it up to a normal part of aging or one of those things associated with being a woman.
But that's not true.
And it's not true at all. The stereotype of the incontinent person is somebody 85 years old in a nursing home suffering from senility. And that applies to less than 2% of people who are incontinent. The more typical picture is actually a 50-year-old mother of 3 who's quite active.
Or even before or after childbirth, I'm told that this can be a problem as well.
That's right. It's a problem across the age range. It's something that affects everybody from children all the way up to the oldest people of all.
What is the first kind of symptom a person would have to be aware of that? I mean, aside from the fact that there's physical evidence that you have uncontrollable retention of your urine.
Well, people often get different kinds of symptoms. One of the symptoms there can be a sense of urgency or frequency, that they always need to pass their urine, and that the urge comes on very abruptly. A way to phrase it is that their bladder surprises them. And that can be the first sign, which, if it gets worse, can actually occur more frequently and quicker than they can get to a toilet. Another problem can occur, particularly around childbirth or after childbirth, called stress incontinence, in which the muscles get overstretched and weak. And then when a woman coughs, particularly when her bladder is full or sneezes, then she can leak. So those are some of the first signs.
And let's talk about the actual definition of this as well, because I think it might help people to get a better grasp or understanding of it. The muscle, the sphincter muscle, is what we're talking about around the urethra. Is that correct?
That's right.
And when a person gets older, do they lose the ability to have this function well? Or in terms of a woman who's had a baby, there's been a stretching of the muscles in that area. Is that what causes the inability of the sphincter to function?
Yeah. Incontinence is probably worthwhile defining for a minute. It's the involuntary leakage of urine sufficient to be a problem. And there are many kinds of incontinence, many types and many conditions that can cause it. The kind that you just alluded to is called stress incontinence, in which that valve or muscle that keeps the urine in gets stretched or weakens as people get older or around the time of childbirth. And if it gets too weak, then when the bladder is full and all the weight of the urine is pushing on it, if the woman then coughs or sneezes or bends over, urine can abruptly spurt out.
Now, you say that things can be done to help not cure, but to control the situation. What are some of those things that are easier remedies to deal with?
Well, actually, it can be cured, and in fact, usually cured. It turns out it's never a normal part of aging, that it is always treatable. It's usually curable and usually without requiring an operation. So
then why don't people come for help?
Well, I think that most people don't know it, and that's why it's so good that you're talking about it today. The simple things, it can result from something as simple as severe constipation, a side effect or reaction to a drug. It could be the sign of an underlying disease. All those things can readily be identified and treated, again, without surgery, and readily respond.
And I understand that this does occur primarily with women, but that it does occur with men, and particularly those who have perhaps prostate problems?
That's right. It occurs in women about 10 times more often than in men, but when it occurs in men, it often has to do with the prostate, maybe a third to a half of the time. The prostate is a small gland. It's usually about the size of a walnut, and it sits at the base of the bladder. And as people get older, it enlarges, and as it enlarges, it can squeeze the tube that urine passes through, causing a blockage. Then the urine builds up and then spills over. So that can be a problem for many men.
And so there's
over the
a lot of
age 50.
frequent urination need, or the urge is there frequently. Is that right?
That's right. But the interesting thing is that the symptoms aren't specific. The same symptoms that cause frequency and urgency in getting up at night to urinate, while they can be caused by the prostate, they can also be caused by other things as well, and that's why it's important to get an evaluation to find out.
All right, the typical things that a woman would be told if she comes to visit the gerontologist, or is it a urologist that they'd also go to see?
Urologist, gynecologist, geriatrician, family physician, anybody with an interest in the expertise.
I understand you probably should have some kind of a diary that you keep.
That's right. The diary is basically a chart that records for 2 or 3 days every time you urinate or leak. What we do is we ask people to record how much they urinate. So they use, for instance, the measuring cup in the basement in a box of Tide. They take that out and they urinate into that and record the amount. That's right. And by recording the amount that they void and the circumstances in which they leak, it provides the clues that are so critical to help the physician figure out the cause.
So there's no way of doing some kind of taking a picture of some sort of the bladder and determining what the problem might be?
Well, there is. That's a sophisticated diagnostic test called urodynamics. But fortunately, we don't need to do that in the majority of people. Just by talking to the person, doing a physical exam, and looking at that diary, that record they brought in, is often enough to get to the base of the problem in most people.
Is it something that you don't go that further step for as far as the picture taking is concerned because of the cost, or?
No, it's because it's not needed.
Not necessarily.
In about half the people. Now, in about the other half of the people, it is, because there's so many causes of incontinence that we need to know exactly what it is in order to figure out the best treatment.
Now, I also understand that what you do is tell them to stop all the nasty stuff like alcohol and smoking and coffee and I don't know what else. Do all of these irritate the bladder? Is that what, or have some
awful,
kind?
Huh? The goal is to help. The goal is to help. The reason to stop the cigarettes is because it causes a cough, and if the person has stress incontinence with a weak muscle, then that can overwhelm it. The alcohol, because it causes the kidneys to make too much urine and overwhelms the bladder, so a spasm can occur. There really aren't very many foods, however, that do much to cause the problem. The basic culprits are anything with caffeine, because they increase the urine production, alcohol increases urine production, and smoking or pills that would cause a cough.
I read somewhere that grapefruit juice is also bad. Is that true?
Turns out there are a lot of thoughts that people have had about this, but because the causes of incontinence are so diverse and many of them go away on their own, people have chalked it up to, oh, I changed to grapefruit juice or tomato juice. There's in fact no study that's ever been done to show whether or not it's true. We're in the process of conducting one now with the Nurses' Health Study at the Brigham and Women's Hospital.
But I am told by so many different people that cranberry juice is what you should take the minute you have any kind of a urinary problem. Is that something you would advise people?
Well, it turns out another colleague in our division studied the use of cranberry juice, and he published the article that that's based on, and found that in nursing home patients who drink a lot of cranberry juice, it does prevent or reduce the risk of getting bladder infections, but he didn't look at the risk of incontinence.
I see. But regarding the bladder infection, is that something that would be an end result of not treating incontinence?
It can be. If incontinence is due to a problem in the bladder, and it's not always, but if it is, then sometimes those problems in the bladder can leave a puddle of urine behind and allow the germs to grow and multiply and cause infections, in which case it would be a problem associated with incontinence. But many of the causes of incontinence, particularly for older people, have nothing to do with the bladder. They're outside. They have to do with drugs they take or other diseases elsewhere in the body.
What are we talking about, Dr. Resnick, when it comes in terms of the total amount of money that is devoted to treating, to caring for people who have urinary problems?
The cost is staggering. the most recent estimates are at almost $30 billion a year.
Wow.
And that excludes what people pay themselves, which can easily exceed $1,000 a year just for pads and diapers and undergarments. To put it in context, it's more than we spend for all the surgery to open up people's arteries in their heart and to dialyze everyone with kidney failure combined.
And here, I know June Allison must be laughing all the way to the bank. I mean, she's on all these various attend and depend and absorbent pad commercials, and it's a big business on advertising. So there's got to be money to be made there, and money is being spent willingly to buy these products.
Well, that's right. It's a multi-billion-dollar industry, and so the makers are very happy with that. And it's okay because they have come up with enormous advances that allow people, in the few people who can't be cured, there is now a remedy that allows them to carry on with life without bulky, crinkling, noisy kinds of things. So they can easily hide them underneath their garments and go along with life.
But that's last resort, is it not?
It is. It's important because sometimes incontinence is due to something simple, so you can cure it readily.
Yes.
Sometimes it's due to something serious, which needs to be detected, and the last thing you'd want to do is just put a garment on and then allow that serious thing to progress. And finally, most people can be cured, so it'd be a shame not to cure them by whatever means, instead of having them waste
If you
their life
begin
doing
with
that.
with the stress incontinence that you mentioned that occurs in a lot of younger women, is this something that progresses to a more problematic or problem type situation later on if that's not dealt with? It
can. The muscles at the base of the bladder do tend to get weaker over time, and it can get worse and worse. Other things can happen as well. And in addition, whatever treatment you want, whether it's a medicine or a behavioral or a surgical, you're better able to withstand the younger and earlier you get started and the more milder the problem when you begin. That's your best chance at cure, so you want to do it quickly.
Kegel exercises. Is it Kegel or Kegel? I'm not sure how it's pronounced.
Arnold Kegel was a gynecologist in the 40s who invented them.
And this is supposed to be something that they teach even children who have difficulty getting bladder trained as well. But this is an exercise that can be taught mostly can it be taught to men as well as women?
Yes, it is for this certain kind of incontinence called stress incontinence to strengthen that muscle. It works very well when it's done correctly. The problem is that most people have trouble learning it. Most people aren't used to having someone tell them, well, contract the vaginal muscle inside your body. There's no reference and no past history of that. So most people need some kind of way to be taught. And there are devices, there's biofeedback, there are a whole host of ways that can be taught. But it does work very well.
Is that what is usually given as or suggested as a part of the treatment?
For stress incontinence, that would be the first thing that we would do.
Now tell me about the federal guidelines that you've been involved with and the report that you've made to the federal government regarding ways in which to deal with this problem.
Congress in the late 80s was concerned that there were many conditions that afflicted enormous numbers of Americans, but for which there wasn't a good consensus as to what the best way to treat them was. And they knew that because they looked and found that there was huge variability in the way that doctors evaluated and treated it. And they asked to find out what are the best things that can be done. So they impaneled commissions to review the entire world's literature and make judgments as to what the current state of the art was. And I was fortunate to be involved with one of those, which was by the Agency for Healthcare Policy and Research. At the same time, the Healthcare Financing Administration asked that a similar thing go on for nursing home patients, which we also drafted.
And how many people were involved in all of this procedure? Were there many of you? Or?
Many. The panel had about 15 people on it, but involved every other interest group and specialty group that had knowledge and expertise in the field.
What happens now if a person is unable to respond to many of the conservative approaches that you've suggested and surgery is necessary? What are the typical types of surgery?
Depends on the cause. For stress incontinence, it's called a bladder neck suspension. And the procedure now can be done in about half an hour, sometimes even under local anesthesia as an outpatient. Sometimes people don't even have to go into the hospital, and when they do, they're often out in a day or even two. For men in whom the prostate's enlarged, the procedure can also be done occasionally as an outpatient and other times as an inpatient, but only a day or two. Recovery is much quicker than it was even 10 years ago.
Is it dangerous to send these people home so quickly?
Actually, it turns out it's not. It turns out that the risk of dying of a bladder neck suspension or a prostatectomy is unbelievably low, well below 1%, much lower. And we're very good now at targeting who's at risk, and those people we, of course, would never send home.
How do we, the United States, measure up in comparison to other nations around the world in the work we're doing, both treatment-wise and surgically?
Well, pretty good, actually. Many of the surgeries have first been devised or perfected in America, and the causes, particularly in the older people, have all been figured out in America. Other countries, though, are working on it very actively, but they have looked to the guidelines that we wrote, both for the nursing home and for the community, as a state-of-the-art that they're modifying now in at least 25 countries, of which I'm aware of.
It doesn't surprise me that we're well ahead of the pack, as they
Well, it's
say.
fortunate.
But it's an issue, it's a topic that is of such grave concern, and so few people talk about it, and it has such an impact on a person's self-esteem, on their social life, on their job. I mean, there are people who stop living almost because they don't know how to deal with this kind of a situation.
Exactly right. People have trouble concentrating at work. They forego promotions, which will keep them farther from a washroom. They won't visit relatives. They won't lift the grandkids. They don't go to church. They won't go shopping. If anybody who you know who's incontinent, they can tell you every bathroom anywhere within a 30-mile radius.
Sure. Are there self-help groups? Are there groups that get together and sort of give each other support?
There are, and one of the best ones is the Simon Foundation for Continence, which is based in Chicago, and they have an 800 toll-free number, along with a book and a video and a newsletter that they produce. Basically, these materials are available for free. The federal government runs another one with the Bladder Health Council from the American Foundation for Urological Disease, again an 800 toll-free number. And then there's the National Association for Continence, which does as well. So there are three groups.
So there's certainly lots of reason to be hopeful and to think positive about this situation. So if any of our viewers are involved with this or have family members who have problems, they should certainly feel that there is a way to turn, a place to turn to, and get good resolution of the problem.
Absolutely.
Yeah. So contact your gerontologist, your urologist, your gynecologist, but get help.
Absolutely.
Dr. Resnick, thank you very much. This has
Thank
been
you.
fascinating. When Time for Living continues, our second effort salute goes to an individual whose only commitment is caring. You'll meet her when we come back, so stay with us. back to Time for Living. I'm Janet Jagalian. This week's Second Effort Salute takes a look at one of those special people who does so much, but so little is said about their contributions and their commitment. This week's heroine is an 82-year-old woman from Orlando, Florida, who just can't give enough. And as Time for Living's Carolyn Murdoch tells us, there's just no end to the kindness of Vantrese Russell.
For 44 years, Vantrese Russell has opened her home and her heart to those who need it most, children with severe disabilities with nowhere else to go.
I need them just as bad as they need me. These children, my life wouldn't be worth 2 cents if I didn't have these children. And I help them, and they help me. I couldn't live without them.
44 years ago, still raising her family, Russell turned her home into a non-profit child care center, taking kids no one wanted.
Susan's born without eyes and backbone, flat-footed. She's 40 years old, and I've had about 36 years.
The money for staff and supplies comes from donations. The care from the heart. Since 1951, 1,200 special needs children have passed through Russell's doors. She's enriched their lives and helped them reach their highest potential. An incredible achievement, one Russell takes in stride.
I couldn't have done this without the support of my family and the people of the community. My children could have all resented me. My husband could have said, that's it. But they didn't. They stuck right by me. Whatever I said went. My husband had enough faith in me that if there's a mountain out there to be moved, I could go do it.
82 years old, she's still moving mountains, one child, one heartfelt smile at a time. I'm Carolyn Murdoch. Time for Living.
What a wonderful and caring person. And just a few months ago, Vantrese Russell was awarded the National Caring Award, which is given to a select few by the Caring Institute in Washington, D.C. We concur that Vantrese Russell was the perfect choice. Now, if you want to suggest somebody for our Second Effort Salute segment, then please write to us at Time for Living, care of Second Effort Salute, Post Office Box 8452, Boston, Massachusetts 02114. Or you can leave your suggestion on our voicemail by calling 800-232-7213 or fax us at 617-329-1774. We'd love to hear from you. When Time for Living continues, we'll be traveling around to a land with a history of political turmoil and a future of unlimited beauty, so stay with us.
Got a 10-minute hit on this one.
I heard.
But it's, you know, it's so great. It's such a great.
I'd just love to go anywhere. I want to go to Aruba so badly.
The dream was staring at pipe.
Welcome back to Time for Living. Now, as our promised, our traveling around segment, that is, today's traveling around is a special one because we visit the fascinating land of South Africa. And while its tourism has suffered because of its past political and social ideology, presently it is a nation reaching out to be seen by people around the world. South Africa, this week's traveling around destination.
Far south on the continent of Africa, there is a land of unrivaled beauty. A land where each day there are new challenges to be met and pleasures to be enjoyed. And this is indeed a land where people have responded to challenges and over the years have been able to gather the abundant mineral resources with which they have been blessed to help meet the ongoing demands of the world, whilst developing their own technology to meet their own ever-growing needs. But nature has given this land an abundance of possibly the world's most sought-after commodity, gold. And it is in gold extraction and supply that South Africa leads the world. The processing of gold has led to the South African jewelry industry becoming an international center for both quality and design. Nature's gift of diamonds has also led to a phenomenally successful industry with a highly skilled and creative workforce. South Africa is truly a mineral treasure store, trading its wealth internationally through a vibrant stock exchange. But traditional skills have not been forsaken. In the field of design and haute couture, South Africans match the best anywhere in the world. Combining the finest African woods with the skills and artistry of the hand, a thriving furniture industry has secured both local and international markets, whilst traditional tanning and shoemaking are both flourishing industries. South Africa is all about people. People who can express their art in creative ways or express their skills through art handed down through generations. It is people who have tamed this land which now brings forth a rich variety of staple foods. The efforts of these people have led to an agricultural explosion, resulting in its ability to be a leading food exporter. Yet, throughout the country, the unique diversity of cultures create a climate of informality, whether it be wandering around an African craft market or experiencing the hurly-burly of one of the many city street markets. Despite this informality, South Africa is a world leader in the development of retail shopping complexes. In fact, the different cultural influences are to be found everywhere and in anything. Although the vast modern cities boast some of the most advanced architecturally designed buildings in the world, the past is never far away. The famous Cape Dutch homes offer a direct contrast to the compact houses of the early English settlers. Churches, too, reflect the vast diversity of South African peoples, from the grandiose dominance of a Christian church to the ornate structures of a mosque in the center of a bustling city. And if Sir Herbert Baker's grand designs are a monument to history, the exotic simplicity of the Ndebele is a testimony to the living past. Once outside the cities, however, South Africa becomes a land of mysterious drama. Buffeted by the winds from two oceans, a phantasmagoria of plant life has adapted to ever-changing conditions, resulting in some of the most profuse natural gardens to be found anywhere in the world.
Certainly a land of many treasures. Now, if you'd like more information about South Africa, we suggest you call Grand Circle Travel at 800-248-3737. That's 800-248-3737. They will assist you in getting more information about this exciting vacation spot. If you want to learn more about the places you've seen in our Travelin' Around segments, you can write to us at Time for Living, care of Travelin' Around, P.O. Box 8452, Boston, Massachusetts 02114. Or you can leave your comments or questions on our voicemail by calling 800-232-7213 or fax us at 617-329-1774. We'd love to hear from you. Now, whether you're invested in the stock market or just wondering what to do with that money tucked away in the mattress, don't go away. Our finance expert, Steve Burke, has this week's financial tips when Time for Living continues. Welcome back to Time for Living. When it comes to financial planning, there are many things to consider. Real estate assets, stock investments, wills, trusts, and a whole lot more. And every week in our Health, Finance, and More segment, our financial expert, Steve Burke, sheds some light or provides some tips on how to make things a little clearer. In today's Health, Finance, and More, Steve talks about Social Security, Medicare, and real estate, and how they can affect your financial planning.
Thank you. Today's segment has to do with updates and reminders about Social Security and Medicare, as well as some information relative to the ownership of real estate, which could well be helpful in your financial planning. First, some new information regarding Social Security of which you should be aware. There have been some recent changes which may impact your financial planning. Of real significance to those affected, namely Social Security recipients, is a new federal law which states that the federal government can withhold up to 15% of federal benefits, including Social Security benefits, if the person involved owes past due debt to the United States government. Should you owe money to Uncle Sam, it's important to be aware of this new situation and to check the guidelines involved. You might review this with your financial advisor or your local Social Security office. Obviously, if you're not indebted to the government, you have no problem. Some other changes to do with Social Security. People ages 65 through 69 can now earn up to $12,500 per year without losing any Social Security benefits. It used to be $11,520 per year. Also, the limit on earnings will increase each year to reach $30,000 in 2002. And finally, in this area, a friendly reminder about disability benefits under Social Security and Medicare benefits. A lot of people think they're easy to come by. Disability income under Social Security is very hard to qualify for. The rules are strict, and there's a waiting period of 5 full months when no Social Security benefits are paid, even if you qualify. Realistically, you almost have to be permanently disabled to realize a disability income. In the area of Medicare, it's important to remember that nursing home care is rarely paid for, and then only for a limited time. As with disability, it's hard to qualify. Fortunately, your financial advisor can help you insure against both exposures. The last area of comment today has to do with the ownership of real estate. While many people have an interest in real estate, sometimes very sizable equity in residence or commercial property, they often don't evaluate the language of ownership. There are pluses and minuses in each. This is important since it can help smooth transition from one person to another, or unfortunately, sometimes create a problem where none should be if the wording is faulty. If you've not checked the way your deed reads and how it passes to others, you may have created an unnecessary difficulty for yourself or family. Tenancy in common sounds a lot like joint tenancy, but are definitely different in terms of results, which may occur because of death, divorce, or any process involving the selling of the real estate. Tenancy in common can limit the control a joint owner of property can exercise. Joint tenancy, on the other hand, means that the other owner has a right of survivorship. This means that should one of the owners die, that share passes automatically to the survivor. Future interest, life interest, term interest, and property held in trust all have different ramifications in your financial plans. For this reason, it's always a good idea to check the ownership of a residence or other real estate to make sure that it is going to end up in the proper hands. This suggests that the different language is there to make sure you accomplish your goals, and that sometimes, if a situation changes, the original language or ownership is going to achieve your desire. An example could be where an older person suddenly becomes less competent, or a young person suddenly is disabled and unable to handle the management of the property. The sum and substance of this area of financial planning is to make sure that the results you desire are reflected in the legal language contained in the proper papers. Certainly it makes good sense to review this with your lawyer periodically. When you think of the fact that most of we experienced citizens have spent 50, 60, or 70 and more years accumulating what we have, it seems only sensible that we take a few moments to plan what we want to happen with what we've got. Whether it's real estate, stock, insurance, or other assets, periodic checkups, just like medical checkups, are a good reason to see your financial planner. And remember to ask lots of questions. This is Steve Burke, Time for Living.
Now, when we return, a woman sharpens her pencil and packs a lunch. She's on her way back to college, and we'll take you there after these messages. Welcome back to Time for Living. I'm Janet Jagalian. All her life, 70-year-old Albina Sadar wanted to go to college, but the needs of her family came first. Now she is fulfilling that lifelong dream at a Pittsburgh area college, and this septuagenarian has chosen a course of study she's comfortable with, gerontology. Albina Sadar is making news.
At the Community College of Allegheny County, you'll find someone who proves you're as young as you think. She's 70-year-old Albina Sadar.
I really have wanted to go to school all my life practically, but we kind of were occupied with hoping that the children would all get their education, which they did. Then finally I thought, well, it would be more productive if I would go to school and hope to learn something and maybe do something with it than to sit around home watching television and reading and doing housework, of course. And I found school to be very, very interesting and challenging, really.
A lot of the problems the functional problems that elders have may be, in fact, reversible, because they may be due to, decreased levels of activity.
Albina is majoring in gerontology, or human aging. It's a subject most of us would think she could teach.
Are you kidding? I thought I could, but there's so much to learn that I certainly was not aware of. I feel there's a lot more out there to be done yet. And I hope I get to live long enough to at least get my associate's degree here.
Although diabetes has hampered Albina's mobility and her eyesight is limited, her determination is as strong or stronger than classmates a third her age.
What your brain tells you should do or can do, you do, and you make your body come along with it, likes it or not. It's important to use what you've got while you've got it. Also, one of my beliefs is do what you can while you can. There are some people who are in the habit of saying, well, we will do this someday, perhaps after I'm retired, etc., etc. However, someday may never come, so grab it while you can.
If you've been thinking about doing what Albina Sadar is doing, then pick up the phone and call your State Office of Higher Education and learn more about the programs available to you. As an older American, most likely you'll find special incentives waiting just for you. Now it's time to meet someone with a real zest for life, someone who is always on the go. Each year, Joe Abbas puts on his running shoes and enters a number of marathons. This 78-year-old runner likes the company he keeps as well as the results of his efforts. Let's catch up with Joe Abbas on the road.
At 78 years of age, Joe Abbas of Dayton, Ohio, is the great-granddaddy of all runners in today's Giant Eagle City of Pittsburgh Marathon. Joe's run 150 marathons in the last 25 years, but then he's the sort of guy who's always been on the move.
I've been active ever since I was a kid. I used to play with kick the can and all that stuff, released it then. Hey, the kid in me never died. I'd like to stay alive, and this is one way that I feel keeps me alive.
Though he's running for his life, Joe Abbas won't set any world records, but when you're 78, just getting to the finish line makes you a winner.
The last one I did in LA, I did it in 7 hours and 12 minutes, which is not too good. But hey, I finished. I meet a lot of very nice people that are in the back of the pack. People who are laid back and they're not trying to win anything. They're out there just for I would say, the camaraderie and the feeling of doing something, staying active.
These Dodgers shuffling along. What an inspiration to all of us. You know, Joe Abbas has run over 150 marathons over the last 25 years. That is quite an accomplishment. We'll be right back. Welcome back. All too often, age creates an artificial barrier between the young and the not so young. But in this report from New York City, Mary Norton shows us how that's changing in at least one community.
Tap, 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 tap. Now tap your toes, tap your toes.
It's Saturday morning at the Margaret Tietz Center for Nursing Care in Jamaica, New York. A time when residents and young dancers have a great time lifting, tapping, and wiggling their way past the barriers that separate them.
It means everything to me. It means that I'm young again, and that builds me up.
The Kids Community Dance Project unites these graceful young dancers with older people through interactive workshops.
The difference of age doesn't matter when you participate. I think it makes you younger.
Okay, so what kind of move do you want to do?
They create dances together, get to know one another, and develop an understanding and appreciation of each other.
You see how the elders react when you talk to them and you speak to them, and they really enjoy it, so it's fun.
Well, I get like this warm feeling inside knowing that I made them happy and I made their day because they smiled so much and they had so much fun.
It enhances their lives. It creates a new aura for them. They yearn for this kind of activity.
Both young and older generations get exercise, a chance to be creative, and learn from new friends. I'm Mary Norton reporting.
Well, thanks for joining us this week. Before we leave, we'd like to give you our address and phone numbers one last time so you can write or call us with your questions or comments or suggestions, because this show is not only for you, it's about you. So please write to us at Time for Living, P.O. Box 8452, Boston, Massachusetts 02114, or send a fax to 617-329-1774. If you don't feel like writing, you can leave us a message on our voicemail, and that number is 800-232-7213. Now, we hope you enjoyed today's show. We look forward to seeing you next week, and we'll certainly have more interesting people and places to introduce you to. So until then, remember, it's time for living.